Hi, my name is Scott Johnston, and I'll be going over the first two portions of Chapter 10. That is describing who the public health workers are, and then I'll be going over several key occupations. So when studying the public health workforce, it is helpful to look at who these people are. The textbook uses an inclusive definition, as you can see on this slide. Essentially, the public health workforce includes any individual whose primary focus is in fulfilling at least one of the essential public health services. Notice they do not specify whether that person works in the government, a nonprofit, or even volunteer workers. Something important to note is that generally this only applies when it's a person's primary work. So in the textbook they give an example of how a police officer might be involved in enforcing seatbelt laws, but basically if that's secondary to their main responsibilities, then it is not typically counted as a public health worker. But on the other hand, I would say that if a specific jurisdiction were training their community police officers to follow the essential public health services as a core part of their department, then that could be included in this definition. So overall, what's important about the definition, just keep in mind it's an inclusive definition designed to fulfill a management level focus, and it's really just trying to get a good grasp of everyone who is inside the field of public health. Additionally, when defining the public health workforce, it can be useful to look at competencies. For everyone in the MPH program, this is probably ringing a bell. We have several core competencies that we have to fulfill to graduate from the program. Competencies are ways that we describe skills necessary to perform public health work at an acceptable level in real-world conditions. Defining the competencies helps establish standards for certifications, helps develop educational curriculums in different public health programs, and these are all taken together and used to help different agencies and different organizations develop their job descriptions so that they can figure out who they want to hire, and then they could later on evaluate the performance of their public health workers as they move through their jobs. Although there are many different sets of competencies, the core competencies for public health professionals are one of the most well-known and widely used sets, according to the textbook. One page of these competencies can be seen on the right part of this slide, which describes the analytical and assessment skills that they think are important in public health. It basically just lists several skills that are necessary and useful for public health workers to have, and there are lots of agencies that use this set, and they would use that to help guide them in their hiring and evaluation process. So whether you're pursuing an administrative role or not, be mindful of these different competencies that are out there, because they will likely be a method used in hiring or just in describing skill sets in the workforce of public health. Moving on, another important thing to note in the identities of those in the public health workforce would be their educational background. The most important thing to know is that public health is an incredibly diverse field, and people from a multitude of disciplines come together to work towards the essential health services. That being said, there are a few degrees specific to public health that should be noted. The Master of Public Health degree, which most of us are studying for, is one of the better known options because it prepares the worker in practical knowledge that is applicable to the field. Only a small fraction of workers actually have these degrees, however, and the book says that that's due to there not being quite enough schools around and programs for that degree. Organizations such as the ASPPH are working to increase the number of graduates, however, as we move further into the 21st century. Other options include Doctor of Public Health or even just PhD that would be in a specific scientific field related to public health, such as epidemiology. These degrees allow for even more specialized training and research skill development, and they are often attained by those seeking leadership roles or academic positions. What's also of note would be degrees in nursing or degrees in medical school, like your MD or DO type degrees. Depending on the programs, people with these backgrounds might not have formal public health training, but they do often end up working in the field anyway, or just working across disciplines with public health workers, so they are included in this. The next important concept that is gaining momentum is professional certification. Currently, there isn't any required certification license to work in public health unless you are a specific, usually more clinical worker such as a doctor or nurse. This might be changing, however. The Certified in Public Health, or CPH credential, is gaining momentum due to the Council on Education for Public Health, also known as CEEF, and the other academic institutions that are pushing for a way to ensure that workers have the skills they need in the core competencies. You can gain this credential by graduating from an accredited program and then sitting for the CPH exam. So just to keep in mind, certification isn't usually required for public health workers, but it is becoming more popular in the workforce. An additional way to help define the public health workforce is by occupational classification or job title. The national labor systems, such as the Standard Occupational Classification, or SOC, that is of the Bureau of Labor Statistics, classifies workers into categories, and they use that to understand the workforce at the national level. They collect information on employment and then other factors such as education, salary, and they use that to analyze different trends in the workforce. There are some complications though. Not everyone who has a job title that would traditionally be involved in public health is actually working towards the essential public health services. For example, that would be an epidemiologist or maybe a public health educator. They would have that job title is traditionally public health, but if they're doing work that's not towards the essential services, they would still be kind of counted in that system, which makes the system a little more unreliable for analyzing the public health workforce. Another issue is that systems like this typically exclude contract and volunteer workers, which hides them from being in the national statistics. So all those volunteers who are out working in various organizations aren't counted, and they wouldn't be in these statistics, even though they actually are doing work. So they're kind of invisible. Finally, job titles are often generalized. So there's a lot of public health organizations that give their job titles such as data analyst or statistical specialist, and those job titles might cross-apply in different organizations as people who work on things that aren't related to public health at all, such as economic data or anything like that. So someone who's a data analyst here versus someone who's a data analyst here, one could be an epidemiologist in actuality working on health data, and one might not be. So keep these things in mind when you're looking at reports on public health workforce numbers, and just as a bonus, keep that in mind when you're applying for jobs in the future. You might want to search for alternate, more general job titles, and that could actually be the position you want even though it has a general job title. The final way to help define the public health workforce that's covered in this chapter of the textbook would be the work site. As I mentioned earlier, there are a wide variety of public health workers, from federal to state to city to county governments, from private businesses and hospitals to nonprofits, and then volunteer workers. The options are honestly quite varied. This is a strength in public health though. Where government agencies are lacking, non-governmental agencies and organizations can step in and pick up the slack. When there are big issues such as public health emergencies, surveillance, disasters, or the environment in general, things that are big, the government agencies at each jurisdiction can do their part. So just remember, the public health workforce is diverse in where they work. There are many options for employment, from public agencies all the way to non-governmental, private, or volunteer organizations, and there are countless organizations where collaboration between agencies can happen. We just need to take the time to make those connections, make that investment, and we can have the both public and private sectors work together towards common public health goals. Okay, so the next big section of Chapter 10 would be occupational descriptions. It is important to understand the roles of key public health workers, so I'm going to quickly go through several of them. The first one is epidemiologists. So this comes from the root word epi and demos, which means upon the people. So at its most simple terms, epidemiology is the study of the incidence and distribution of health outcomes and risk factors. So anything that's a health outcome that goes upon the people would be what they would study. Typically, this methodology is used with the goal of prevention and control of disease, whether that be chronic or infectious, but the techniques can be used in the analysis of any health status. So epidemiologists have made the connections between smoking and lung cancer, seatbelt use and car crash mortality, lead exposure and nervous system development. Anything where there is a risk factor or exposure, and then an outcome or disease. They do this by designing studies, analyzing surveillance data, and drawing connections between risk factors and greater or lesser incidence of disease. Typically, they have at least a master's degree or MPH degree, but some also get their PhD. They traditionally work in public health departments at the local, state, or national level, but some are employed in private healthcare systems, consulting firms, or other private organizations. So the picture I included here is of the epidemiologic triad from the CDC, and it just represents a fundamental model in epidemiology to help explain incidence of disease. So feel free to look at that if you would like. And moving on from epidemiology, the next occupation would be the biostatistician. This often overlaps with epidemiology, but it is more specialized. They're more specialized in statistical theory, techniques, and models, and they're actually usually more involved with the analysis of the health data, more than anything else. So moving on, the next is educators and behavioral scientists. With many health outcomes, there are personal behaviors that play a role. Understanding human behavior and helping educate the public on how to live their healthiest lives is an important tool in helping prevent disease and other negative health outcomes. These workers are involved in the planning, implementation, and evaluation steps of interventions, and they are key members of the public health workforce. Communication, knowledge of the social determinants of health, and knowledge of behavioral science are all important skills for these workers. Next up is environmental health specialists. These workers specifically work towards protecting the environment around us, and through that, protecting our health. Whether it is air or water quality, food safety, or even waste management, these workers play key roles in the field of public health. Interestingly, this is a field where workers can oftentimes be more non-traditional public health workers, such as engineers, toxicologists, hydrologists, people who work specifically in environmental science. So I included here a figure from the EPA, where it shows like the air quality index, and there would be scientists studying air quality who would put out these figures, and this is involved in public health because it's recommendations for the public on safety concerns from day to day based on the air quality, from day to day based on where you are, how much pollution levels there are, and that sort of thing. The next occupation is nurses and physicians. These healthcare workers play an important role in public health, and many are being directly trained in core public health concepts through their education. Nursing itself has a subfield of public health nursing where they work with populations to assist with disease prevention, and nurses actually have a long history of being involved in this field, as you can see in this vintage poster that I included. An equal chance for equal health, it says, and that's from 1919 in an advertisement for public health nurses. An example of this would be infection control nurses in many hospitals today, where they work within the subpopulation of the hospital to prevent the spread of these communicable illnesses. Physicians typically work in primary care, but some do receive formal training in public health as well. We have a program here at KUMC. There's several med students who are taking a year off to do, well, it's not really a year off, they're taking a year to do the public health program all in 1 year, and then going back to their MD training. With the positions they often hold as leaders in their communities, local physicians can be valuable partners in public health if the connections and partnerships are made. So the next one up is nutritionists. Diet trends at the population level can give valuable information on the health of our people. Nutritionists help plan eating guidelines, and they work in programs such as WIC to help maintain healthy populations. Here I included an image from MyPlate, which was created by the USDA. Nutritionists made this, and it helps improve public health across the country, making them key workers in the field of public health. For this slide, I put health services administrators and dental health workers. So for administrators, it presents an interesting challenge. Many of them are recruited from fields outside of public health, and they must be taught the unique perspective and goals of the field, but nevertheless, they are vital to the workforce, and they oversee funding, communications, human resources, other managerial roles that are very critical to the success of public health. As for dental health workers, first thought people often have is that it's a much more clinical, personal role, but they are really involved in the preventative discipline where it involves the population. Additionally, fluoridation of water is a valuable public health effort that prevents dental cavities, making them a key part of public health as well. So we've just taken a look at the occupations that the textbook presented to us regarding public health, but there are many dozens, if not hundreds more occupations that are out there. Most workers, no matter what their actual title is, have experience in a variety of areas. Typically, being a generalist like that is a benefit and allows smaller departments to succeed in providing the essential services within their financial means. What is important, however, is that when the level of expertise a worker has isn't adequate, they should look to an expert or specialist for consultation and added support. Many agencies have specialists devoted towards specific areas such as immunization, smoking, or epidemiology. This is beneficial as it allows each person to focus in on their strengths, but the difficulty here comes in when people must work together to solve the problems that involve more than one specialty. So since it can be a problem having lots of people come together and work from all these different occupations, people have been looking for solutions to that, and one of the big solutions is interprofessional development. We all went through a training of interprofessional development, or at least most of us did this semester, and training like that is vital in such a diverse a field as public health. You heard all the different occupations that we just went through. Bringing them all together to solve the issues that we are facing today is key to moving forward successfully. So I just wanted to add in, as you continue moving forward in public health, finding your specialty and your interests, remember to learn about the different occupations around you and the people that you work with every day, and then we can form the best public health workforce possible.
Hi, I'm Kathy Benich. We're going to continue forward looking at how many and what kinds of workers are needed. Some of the same themes that Scott mentioned that make difficulties in counting will be seen here as well. Let's look at a historical perspective. First off, it was influenced a lot by trends in morbidity and mortality. And infectious diseases were brought in because that was the predominant cause of mortality. You would see things like trying to come up with assessments and counts, such as one nurse for every 2,000 to 2,500 persons, or one sanitary and nuisance inspector for approximately every 25,000 people. Then the shift in the latter part of the 1990s was more towards behavior-related conditions, such as cancers, heart disease, and that broadened the look at public health to increase the need for health educators and behavior scientists. But then, as research advanced, it also broadened more, bringing in environmental factors, such as lead paint in houses, air quality, pollutants in the air, and that brought in the need for workers with engineering and technical backgrounds. So it kept broadening over time. Finally, the focus was set on those 10 essential functions that Scott mentioned early on. So let's look now at the present and future perspectives. So precise counts depend on availability, affordability, and quality of healthcare resources. So what that means is some communities may need more healthcare workers than others based on the availability and affordability of those sorts of resources. We are also seeing that changes in accessibility of insurance will change the mix of public versus non-governmental agencies. And that's a real issue right now, even in the presidential election, as to what that focus should be, whether it should be on marketplace options for healthcare or making it more governmental, such as Medicare for all. So those changes will change the need for the types and kinds of workers needed as well. There's also a lot of partnerships and collaborations starting to happen with healthcare providers. And so it's more of a public-private mix. And so over time, that mix has been changing, and it looks like will continue to change. So looking at the counts and types of workers that are needed now, as I mentioned, there's a lot of difficulty counting due to the inaccuracies, not knowing, how to count certain folks, and when a certain piece of their job is public health, but not the entire job. And a lot of the surveys that we're seeing that show the number of public health workers are also tied to specific legislative and policy initiatives. So they're not maybe looking at it from a totally clear lens. They might have, a little bit of a slant to it in order to look at their specific legislative or policy initiatives. In terms of workforce enumeration, reliable planning and counting is needed because you really can't plan for the future unless you know how many you have now and where you need to go in the future. So there was something called Renumeration 2000, and that counted 448,244 public health workers for every 635 persons. And that also counted the nearly 3 million volunteers that augmented the public health system. And that term, those stats were used for quite a while, but more recently there was a count in 2011 which also found issues with counting. They said there was a lack of clear, concise, and mutually exclusive classification schemes and categories. So meaning somebody could fall in more than one category, so how do you count them? There's also an absence of credentialing requirements, which Scott also mentioned that there may be some credentialing requirement changes in the future, and that could be as a result of this issue with counting. And then also the professional workforce is educated in specific disciplines that lack public health training. For example, a dentist might not be educated in public health training, but he or she still handles some things within the public health realm. And so those folks are not counted as well. So a lot of issues with enumeration. Let's move on to the future trends and what we're hoping to do about this. There's uncertainty in the future demand because of this, this history of not being able to count and not knowing who fits in which buckets. There's also a shift from government agencies and a decrease in funding, which we saw in our reflection last week as well, the decrease in funding. In 2003, the Institutes of Medicine put together a Who Will Keep the Public Healthy report, and it recognized 8 fields of expertise of growing importance. And so let's just review those. First, informatics, which that's really an emphasis on data, which I think we see a lot of that happening now, where we know hotspots as to lots of cold remedies are being bought in a certain area. And so informatics can take a lot of data, pull that together to come up with, are there hotspots, are there trends, what's happening here? Genomics, and we're seeing that getting even more attention with the public, just the average public wanting to get their own genomes sequenced, wanting to know what sorts of things might be hereditary in their family so they can plan for family members. Also, communication will be of growing importance. Cultural competencies and community-based participatory research. Also, global health, because as we've seen with the coronavirus, we are one big world, and we cross borders pretty easily, as do diseases. And there's also public health policy and law, and public health ethics. Those will be the hot trends coming up.
What strategies can enhance workforce capacity? The private sector may have an advantage in the competition to hire skilled workers and deliver highly technical or specialized services, despite government's primary responsibility for core public health functions. Some of the disadvantages public health agencies have are the broader policy interests of civil service hiring systems, the lower compensation levels, and the lower perceived prestige or status of public sector employment. Some of the approaches to countering these disadvantages are the listed strategies that I'll discuss in the upcoming slides. One strategy has to do with undergraduate public health education. A report on the public health workforce strongly recommended at least some public health courses should be offered to undergraduate students to increase the public health literacy of the population and to attract students to graduate study in public health. This could provide much-needed entry-level field staff for public health programs and services, particularly at the local level. With graduate public health education, the ongoing interest in public health has led to the growth in schools of public health and graduate programs offering the MPH degree. One issue with graduate education is that faculty for these schools and programs are often scholars with limited experience in public health practice. Some necessary changes to graduate education include development of faculty with practice expertise, increasing student involvement in public health agencies for fieldwork, and active efforts to provide continuing education to the already employed workforce. Another strategy is training for employed public health workers. These workers, already in the workforce, have a diverse education and experience. So much of their educational preparation is specific to a single professional practice area, which may or may not include public health specific content. So many workers need general orientation to public health. This can include both worksite-based and online training. With worksite-based training programs, these started in the late 90s, and the HRSA and CDC first introduced workforce development programs designed to enhance access for working professionals. The CDC awarded competitive 3-year grants to public health schools to develop distance-accessible MPH programs for the agency's employees, along with any other interested students. The HRSA developed a competency-based training curriculum suitable for distance media and provided a series of short courses. Shortly after, it launched the Public Health Training Center Network. In 2010, the Patient Protection and Affordable Care Act increased funding for the network to improve the nation's public health system by strengthening the technical, scientific, managerial, and leadership competence of current and future public health professionals. Another type of training for employed public health workers are the online training resources. Although many public health workers are located in urban areas with many resources, many others work in small and isolated agencies that would require extensive travel to training sites. Distance learning technologies help with these limitations by decreasing travel funds and potential limited staff that would have to assume the responsibilities of those who are attending training events. The original example of web-based learning resources is the Super Course, made up of lectures on global health and prevention. It currently has a network of more than 56,000 scientists in 174 countries, sharing a free library of 5,300 lectures in 31 languages. In 2011, the Institute of Medicine and the Public Health Community called for improvements in preparing the public health workforce. In response, the CDC began to expand e-learning through the CDC Learning Connection and CDC Train within its mission to support state, tribal, local, and territorial public health workforce development. Another strategy to enhance workforce capacity is career development. The future of the public health in the 21st century reviews the nation's public health capabilities and notes that public health leaders must have mastery of the skills to mobilize, coordinate, and direct broad collaborative actions within a complex public health system. Succession planning and individual career development are understood in the private sector as essential to a business success plan. Driven by this concept, the national and regional public health leadership institutes have emphasized leadership skills needed to move the public health enterprise forward, rather than teaching specific techniques for managing individual programs. As described in the chapter, there are many uncertainties. Regardless of how those issues may resolve, there are several things to consider for workforce professionalism, performance, and policy, which include professional credentialing, systems research, and quality management. With credentialing, the National Board of Public Health Examiners now oversees the credentialing of public health professionals. It supports a national set of standards for competency and awards the Certified in Public Health credential to those who pass its examination. Credentialing also formalizes the process of continuing education for the public health profession. This potential is limited at the time of the textbook's publication because only a small proportion of public health workers meet the NBPHE's prerequisite of a graduate degree from an accredited school of public health. Recently, they've indicated they're open to relaxing that requirement, and doing so will extend the incentives of credentialing to a larger number of public health workers. Something else to consider is public health systems research. In 2003, the Institute of Medicine's Committee on Assuring the Health of the Public for the 21st Century found insufficient evidence for recommending precisely the number and types of public health workers needed by states and localities. At about the same time, a CDC-sponsored public health workforce initiative recommended an agenda for public health workforce research with 5 top priority elements, which are listed below. Quality management is also something to consider in the future. The Public Health Accreditation Board administers voluntary public health agency accreditation activities that will have a profound effect on the public health workforce. The goal of accreditation is to improve the performance and capacity of public health agencies to perform the 10 essential public health services. The governmental public health agency workforce has not been well trained in these areas, and this will require a new skill set. And with that, thanks for watching, and I hope this gave you a better overview of the public health workforce.